Are you interested in introducing solid foods to your baby but not sure about how to go about that? Should you do baby-led weaning? Should you introduce with puree foods? Should you introduce peanuts or highly allergenic foods, or should you wait? In today's episode, we're going to cover all of these questions and more and go through a really detailed analysis about what the evidence shows about how to introduce solid foods to your infant.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Good morning. We're back here in the studio at Be Kind Pediatrics. And today I want to talk a little bit about the introduction of solid foods. I know with my own son, I had a lot of questions about baby-led weaning versus purees. Are there certain foods to start off with? Or are there certain foods that should be avoided? And so we're going to kind of break it down today and talk about each subject. So let's first talk about when you should think about introducing solid foods to your infant. So usually I start talking about the introduction of solid foods somewhere around the 3 to 4 month visit. And there's a few reasons for that. The first is the introduction of solid foods does matter for certain things. Like, for example, there was a well-published study called the LEAP trial looking at introduction specifically of peanuts, but allergenic foods. Does it matter when you introduce them? And the answer to that is yes. So early introduction of allergenic foods, and we'll talk about this in greater depth, before 7 months is really ideal to reduce the risk of developing a food allergy. So before 7 months from an allergy standpoint. Then there were other studies looking at things like, does the timing matter for development of obesity? And yes, that also does matter. So usually I start talking about this at the 4 to 6 month visit. And I usually start by talking about when the differences between puree foods and baby-led weaning, because that matters for when you're going to introduce foods. For example, baby-led weaning, you have to wait till closer to 6 months. Purees, you can start closer to the 4 month mark. And I think the most important thing when you're deciding when to introduce solid foods to your infant is your infant developmentally ready for the introduction of solid foods? So that kind of we're looking at things like head control. So you want to bring your baby into your pediatrician, make sure they have nice, good head control, that they're able to sit with support well. Babies who instinctively, if you put something in their mouth, they kind of thrust it out or thrust their tongue out. That's called an extrusion or tongue thrust reflex. If you're seeing that, they may not be developmentally ready yet to start foods. And then one thing, and I think one of the most important things is your baby interested in food? So are they looking at you or their siblings while they're eating? Are they kind of have those baby doll eyes when you bust out family dinner? That's an important cue that they might be ready to start eating food. So the next kind of natural question, I think, when you're asking yourself, is your child ready or at the developmental point where they are ready to start introduction of solid foods? Do you want to do something called baby-led weaning, or would you like to start with a puree method? Or would you like to do a combo of both? So you can start with purees and then move on to baby-led weaning. But let's talk a little bit about baby-led weaning, how it's done, and the studies or evidence that exists for it to date. So the main difference between puree feeding and baby-led weaning is puree feeding is when you take a food and you mash it up in a puree, or you can add breast milk or formula, and you spoon feed that to your baby. Baby-led weaning, the baby really needs to be closer to 6 months old because they need to actually grasp food and be able to get it to their mouth. And that coordination just really isn't there until a baby is closer to that 6 month age mark. So baby-led weaning looks like taking foods that are soft and mashable, like a cucumber, for example, or a cooked zucchini, cutting it up into a piece that a baby could pick up and bring to their mouth. The idea behind baby-led weaning is this allows babies to self-regulate or control how much they're eating. And so there is an idea that it might be a more positive feeding experience for a baby, and again, promote more self-regulation of food intake. The studies, the concerns really were, could there potentially be an increased risk for choking hazard because you're allowing your baby to feed themselves? And the studies thus far show the difference between choking hazards or choking episodes in general between baby-led weaning and puree feeding are about the same. So it does not matter from a choking standpoint if you want to do purees or baby-led weaning. From a standpoint of self-regulation and later development of obesity, there was a randomized control trial looking at the difference between baby-led weaning and pureed feeding. And then they looked at BMIs at 12 and 24 months, and they found really no difference. So up to at least 24 months, there's really no difference that baby-led weaning versus purees has any impact on obesity or BMI. There was some subjective reports in that randomized control trial that mothers reported babies had a more positive experience with feeding, and so that is a potential benefit of baby-led weaning. And then there's a combination of both. So I see a lot of families start off with the introduction of purees at 4 months, and then they move towards a more baby-led weaning process at 6 months with allowing babies to feed themselves and self-regulate. If you are going to do baby-led weaning, I usually recommend that you feed your baby either breast milk or formula an hour before you allow them to have a new food. That way they're kind of full and not super hungry, and then able to use this complementary food. Because really, up until 12 months, all solid foods are still a complementary source of nutrients or complementary food source, meaning that formula or breast milk should be their main source of nutrition, and solids should just complement their nutrition. That does not mean that you should wait till 1 year, that feeding your baby is not important before 12 months. Certainly learning the skills, learning the varied textures, it's important for allergy introduction. It's important for reduced risk of obesity and learning to feed in general, kind of acquiring these skills of using a spoon, so, the coordination of eating. Those things are all important lessons to learn before 12 months, but from a nutrient source, still the vast majority of their nutrients are coming from or should be coming from breast milk or formula. I would say the main concern with baby-led weaning is going to be, is there any concern for micronutrient deficiency, specifically iron? Because the types of foods that are rich in irons, like meats, oatmeals, fortified oatmeal, etc., they tend to need to be pureed, and they're not able to be usually fed to a baby in a consistency that's compliant with baby-led weanings. And then the other real concern is, are you able to introduce all the allergenic foods with pure baby-led weaning before 7 months? Because really you want early introduction and consistent or frequent introduction to reduce those risks of allergens, especially with the highly allergenic foods like tree nuts, peanuts, eggs, dairy, shellfish, etc. The other common question I get from parents when they were deciding when to introduce complementary foods is, does the introduction of complementary foods affect the baby's ability to sleep at all? I think there's kind of this old wives' tale out there that feeding your baby solid foods helps them sleep through the night. And so there was actually a nice study published in JAMA Pediatrics. It was a randomized controlled trial. They looked at about 1,300 infants, and they looked at introducing complementary foods at 3 months versus 6 months, and did that affect sleep at all? So what they found is actually the babies who had solids introduced at the 3-month mark or the earlier end did sleep on average about 7 minutes more on the earlier end, and then towards 6 months, about 17 minutes more. And they did have fewer nighttime awakenings. So on average, they had 2 less nighttime awakenings than the later introduction of solid foods. But there is also some conflicting data out there, because there were other studies. For example, there was a study that looked at the early introduction of rice cereal or baby cereal in bottles early. Did that affect sleeping? And that study found that there was no difference between the duration of sleep or nighttime awakenings in the babies who were fed rice cereal at night at a young age. So the evidence is a little conflicting, but I would say probably, again, what these studies show is the sweet spot is somewhere between 4 to 6 months for the introduction of solid foods. And that there may be some benefit to sleep to an early introduction towards that 4 to 5 month mark versus waiting towards 6 or 7 months. I think another important aspect of that JAMA Pediatrics study, looking at the introduction or the early introduction of solid foods and sleep, was does it affect breastfeeding at all? Because a common question I get from parents is, if I introduce complementary foods early, is that somehow going to affect my ability to successfully continue to breastfeed? And they found in this study that really it did not affect the success rate of continued breastfeeding. So introduction of complementary foods is kind of, like I said, a secondary source of nutrition, and the primary source will still be breast milk or formula. And what we know so far is the earlier introduction does not affect your ability to go on and continue to successfully breastfeed. Meaning in both groups, both the early introduction and the late introduction, they breastfed for equally as long time. So that timing probably didn't play a huge role in how long mothers were able to continue breastfeeding. So I think the next natural question after you've decided when you're going to introduce complementary foods to your infant and what method you're going to choose, or if you can use a combination of both, it's how do you actually do this? So again, usually I start talking about this with my parents around the 4-month visit. And I say, you want to start with single ingredient foods. So that means you just start with bananas and you do that for a couple days. And then you start a second ingredient and so on and so forth. I have parents with a lot of questions about should we start vegetables first? If we start with fruits, are they not going to eat the vegetables? There's been a lot of research around this subject, and really there's no strong evidence to support starting one food group over the other. I think the more important question is kind of the how. So if you're going to start closer to the 4-month mark, you want to get a really good pureed consistency, closer to the consistency of the breast milk or formula. And so usually I say take in a single ingredient, actually puree it and add breast milk or formula to it, and then spoon feed that to your baby. If your baby is thrusting it out, that's a sign that they immediately kind of thrusting their tongue out and spitting it out. That might be a sign that they're actually not yet ready for the introduction of foods. Or if they're kind of moving their head away like this, that might be that they're just not hungry. So wait a little bit and come back and try again. I usually recommend that you do this after a semi-full feed. So you've either breastfed or bottle fed your baby so they're not frustrated and they're not super hungry, because again, learning to spoon feed and feeding in general is a new skill. So if you're baby led weaning or spoon feeding, we're asking the baby to learn a completely new developmental skill. And it helps if they're not hungry and frustrated to do this. So feed them a little bit first with their either breast milk or formula. Choose your single ingredient. If you're closer to that 4-month mark, you're going to puree it and maybe add a little breast milk or formula to that. And then you slowly increase that consistency. So closer to the 6-month mark, that consistency is going to be more like fork mashed, 6 to 9 months, like a fork mashed avocado, for example. And then again, around that 6 to 9 month mark, you can start to introduce cooked mushed fingered foods and do kind of more of a baby-led weaning type of food introduction. A really nice app that I tell my parents about is Solid Starts, because it tells you exactly how to prepare food based on a baby's age and if that food is safe and appropriate. So I think it's a really nice reference to have if you're considering introducing new and interesting foods, and I encourage you to do so. I have patients who introduce pate or puree. Certainly pureed meats is a great idea, pureed fish. I love to recommend that parents start off with introduction of salmon because it has a lot of great fatty acid, omega-3s. It introduces that fishy taste to your infant at a new age. So salmon a couple times a week is also a great first food to start off with. Speaking of kind of those fishy foods like salmon, I tell all parents you should expect that it might take 8 to 10 times of a new ingredient for your infant to get used to the taste and actually enjoy it. So if you try something once and it doesn't seem to be your infant's favorite, I wouldn't just push it off. Keep trying a couple times. It takes them 8 to 10 times to get used to a different consistency and taste and really accept that food. And in terms of consistency, I do recommend that you try to vary the consistency and textures as you introduce foods. And so using some home cooked purees is a great way of doing that. When you buy store-bought purees, they're often the same taste and same consistency. It's important to get children used to having varied consistencies so that they don't kind of selectively avoid foods that are not the same consistency every time later in life. So that's the kind of how-to. Again, you're going to start with, if you're going to start at that 4-month mark, you're going to start with pureed foods that are closer in consistency to the consistency of breast milk. You're going to spoon feed your baby 1 to 2 little tiny baby teaspoons, no more, per feeding. And you're going to do that right after you've already fed the baby so they're not super hungry and frustrated. And you can try that once or twice a day and then build up that consistency to more fork mash towards the 6 to 9 month mark, and then looking for more cut and self-feeding techniques, again, closer to that 6 to 9 month mark. So once you've kind of decided how you're going to do this, again, the next kind of question is, what kind of foods should I start with? And we just talked about this briefly, but usually I recommend starting with either an oatmeal. I think is a really nice choice. I recommend that you start with more whole, less processed foods. In the past, a lot of parents started off with infant or baby rice cereals, but there was a study in JAMA in 2016 looking at infant rice consumption, rice product consumption, and exposure to arsenic through urine arsenic levels, and they found that babies who consumed more rice products did have higher levels of urine arsenic. The FDA is currently working on regulating arsenic levels in baby food products, specifically rice foods, but because rice has this risk of exposure to arsenic and it doesn't have a ton of nutritional value, it's not my favorite food to start off with. I usually recommend something more like an oatmeal, which is a more whole food and less processed, and has more nutritional value. It's also a little bit more flavorful and tasty. Rice tends to be kind of bland and not give your infant that developmental stimulation of taste. So I go for more whole, less processed foods, and then you're also looking at the nutritional content of those foods. So in an ideal world, you're going to try to choose something, again, that's either wild grown or organic. But if you can't get those, my preference is still to go with healthy foods over organic foods. So it's better to have a non-organic blueberry than a organic processed, like rice cracker, for example. So try to pick foods in the beginning that are adding nutritionally to your infant's diet. So things that are iron fortified, calcium rich, foods, and then try to vary those textures and flavors. So like I said before, salmon is a great option a couple times a week to get those fatty acids, those omega-3, that fishy taste introduction. If you can go for the wild caught type of salmon, I know there's a lot of concern about deep water fish and mercury contamination. So again, you're better off going for more wild caught options. But still, even if you can't get wild caught, salmon is still a great food to start off with. Avocado is a great one. Oatmeal's great. Bananas are great too. Fruits are amazing. And then the other thing you just kind of want to consider is when you start to introduce solid foods, some of these foods are more constipating than others. So for example, ripe bananas, oatmeals, these things tend to be more constipating. So try to balance that with foods that are high in fiber like peaches and pears. The other thing you can do to just kind of simplify your life in general, and this is what I did, whatever I made for dinner, we just pureed it and we added a little breast milk to it. That gives your baby exposure to lots of different flavors and tastes, while also, varying the textures so they're not getting used to the consistently same texture and flavor. And it also provides a kind of nice nutrient balanced diet. The only kind of thing I would say is just be careful about how much salt you put in your food because babies' kidneys are still a little bit mature and they can't handle a ton of salt. So something I sometimes do if I like my food a bit on the salty side, I would just put aside a little bit of what I cooked before I added the salt to it and pureed that and fed that to my baby and then continue to cook and add the salt for me. So then I think, again, kind of the next natural question is we've talked about foods that are great to start with, but are there any foods your baby cannot have? So there are a few you should be aware of in the infant period, so in that less than 12-month-old range. You want to avoid honey until your baby's at least one because of the risk of infant botulism. Honey contains some botulism toxins, and infants less than 12 months old, their gut isn't fully matured, and so they're at higher risk for infant botulism. So again, avoiding honey until your baby's at least 12 months old. Avoiding cow's milk or dairy milk. Cooked dairy is actually okay. So like butter, a cooked muffin, if you want to use a muffin and puree and add breast milk to it, that's totally fair game. But straight cow's milk in the form of a bottle or liquid feed, I don't recommend because their babies are not quite ready for bovine or dairy, cow's milk dairy, and it can induce a little bit of colitis, meaning their lower bowel gets inflamed, which can actually inhibit their ability to absorb nutrients. And then it also puts your infant at risk for iron deficiency anemia, which infants are already kind of at risk for. So avoiding cow's milk until your baby is one. And then after one, I really actually do recommend it because it's a great source of calcium. It's a great source of vitamin D. It's got a ton of great fats and proteins in it. If your family wants to be dairy-free after one, there are lots of great options and sources of calcium and vitamin D, fats and proteins. I just recommend that If you're going to go dairy-free, just, discuss it a little bit with your pediatrician or registered dietitian to make sure that you're covering all of your other macro and micronutrient bases. So avoiding honey, avoiding dairy until they're at least 1. Water is another big question I get about. Your infant does not need additional water. Not only do they not need it, they probably cannot handle it. Again, their kidneys are a little immature still. And so if you give an infant extra water, what actually happens is you dilute their blood. So your blood's kind of made up of all these electrolytes, and adding water dilutes it. And it can actually put your baby at risk for swelling, specifically in the brain. So you want to avoid water until they're at least 1. If you feel like your baby needs a little extra hydration, just give them a little extra breast milk or formula. And then the other foods I don't recommend that you totally avoid, but you should be aware about, are the choking hazard foods. So that's classically going to be things like hot dogs, popcorn, nuts, nut butters, grapes, grape tomatoes, anything that's kind of small and circular. So for the nut butters, and nuts, you want to introduce, if you want to introduce peanuts or tree nuts to your infant, you can use the nut butter, but you don't want to use a thick glob. You add a little bit, again, to either breast milk or formula, dilute it down, and introduce the nut in that way. For eggs, that's another food, by the way, to do for early introduction. You can scramble them, hard-boiled egg, and then again, scramble it and add it to breast milk to kind of puree it down. Tomatoes or grape tomatoes and grapes should be cut up into small fourths until your toddler is about 4 years of age. Raw vegetables is another one. Hot dogs, these things all need to be cut up into smaller size, bite-sized pieces. Again, I recommend Solid Starts. They have great pictures showing you exactly how to cut up these foods at what age. And so until your child is 4 years old, really nuts, popcorn, hot dogs, raw vegetables, grapes, and cherry tomatoes all remain significant choking hazards, and they should be continued to be cut up until your baby is closer to 4. Other kind of special micronutrients to consider when you're thinking about introduction of foods, or really just in general, the beginning of your baby's feeding journey, is to think about vitamin D and iron. So from a vitamin D perspective, there's actually no vitamin D really in breast milk. It is often added to formula, but you need to be eating at least 32 ounces of formula to get sufficient vitamin D. So all infants should be supplemented with 400 international units of vitamin D until they're at least drinking 32 ounces of formula, or until they get enough vitamin D from their complementary foods. So I usually recommend supplementing 400 units of vitamin D really until the baby is almost a year old. And then sometimes even beyond that, because I find vitamin D is one of those micronutrients that is usually missing in a lot of our diets. The other micronutrient I talk a lot about is iron. And so babies get all of their iron really transplacentally during delivery, which is one of the reasons we really promote delayed cord clamping. But there's actually no or very minimal amounts of iron in breast milk. It is added and fortified to formula, but for infants who were either premature, and so they didn't get as much of that iron, or they are exclusively breastfed, the AAP recommends supplementing those babies with 1 milligram of iron per kilo per day until they get enough iron from their diet. And so usually I do start babies around that 4 to 6 month mark again on iron supplementation, especially if they're premature or exclusively breastfed, until we've really ensured that they're getting sufficient iron from their diet. Good sources of iron in the diet, again, are going to be things like pureed meats, iron fortified oatmeals, etc. And the reason I'm so concerned about iron is because iron deficiency anemia can lead to poor neurocognitive developmental outcomes. It's been associated with lower IQs. And so again, it's really a micronutrient we want to make sure that we've optimized and that your baby's getting enough of. One of the last things I kind of usually go over with parents at the 4-month visit when we're talking about introduction of solids is what is choking, what is gagging, and what does a food allergy look like. So let's start off with choking and gagging. Choking really looks silent, so the baby's not making any noise. They're not able to get any air through their passage. They usually look terrified and concerned, versus gagging. The baby's often making noise, spitting things out. They don't look so concerned about it. They could kind of care less. Gagging can be a normal part of learning how to eat. Choking is not. So at the first signs of choking, you want to call 911. I teach all of my parents at the 4-month visit how to do appropriate back thrusts. And sometimes we even, depending on the concern, do an in-office basic infant CPR class. And sometimes I will recommend, or I usually do recommend, all parents get some basic infant CPR training. And then, I recommend that any caretaker who is taking care of the baby for a significant amount of time, especially around eating, or just caretaking in general, not even having anything to do with eating, I do recommend infant CPR for all of my patients. So this is just one more time where I kind of bring it up and say, if this is something you would like to do, let's do it. Let's schedule an appointment and do it in the office. Once you kind of understand and are prepared and know the difference between choking and gagging, the next thing I talk about are signs of food allergies. So the most common sign of food allergy in an infant is going to be hives, but it could be multiple systems. So you could have hives, you could have vomiting, you can have diarrhea or frequent mucousy loose stools. You could have lip swelling, mouth swelling, facial swelling, difficulty breathing, wheezing. And really what I tell parents is, if one system is involved, that's okay, it's a food allergy and we should be aware of it, but 2 systems constitutes anaphylaxis. And at that point, you need to call 911. So that's going to be any 2 separate organ systems, skin and GI, which is going to be hives and diarrhea or vomiting, skin and lip swelling, mouth swelling, or difficulty breathing. Although usually I say if a child is having difficulty breathing, lip swelling, mouth swelling, if that particular organ system is involved, I recommend you just call 911 regardless, even if that's the only symptom. Once you have identified or suspect that your child has a food allergy, the next thing I usually recommend is trying to narrow down what the food was. So if you've gotten a couple ingredients in that food, trying to isolate it by just history. So let's say you fed your baby a peanut butter smoothie and you used dairy peanut butter in it. Is the peanut butter? Was it the milk? Usually I say, okay, let's then feed your baby milk and see if they have an allergic reaction again. Then we know it's the dairy. If not, we'll do the peanut butter. Then we know it's the peanut butter. Once we've identified any concern for an allergy, though, at that point, you really should go through EpiPen training and have an EpiPen at home. So all of my patients who have concern for an allergy go home with EpiPen training and an EpiPen prescription and how to store it and handle it. And then the next thing parents usually talk about once they've had this experience is, should we test for other food allergies through the blood or skin? And my recommendation really is not to, because the blood testing doesn't have a very high predictive value, and it often leads to unnecessary food restrictions. I really only recommend specific blood testing if there has been a history of an allergy to a specific food. So for example, you gave your baby dairy and they broke out in hives, then yes, we can consider doing some serum testing, but I usually do that in conjunction with an allergist at that point. I've had some parents ask me, can I put the food on the baby's skin and see if they're allergic to it myself? Again, it is not a verified way to tell if they're food allergies, and often leads to high false positive rates because just the food on the skin can be irritating and look like an allergy. So I don't recommend doing that at home. Really, the way to do it properly is just to kind of have a consultation with an allergist or a pediatrician and see what the best route is to go from there. So then there is a special consideration for children with either severe eczema, so those requiring repetitive applications of steroids, or children with known egg allergies, to get IgE testing. That's a blood test for peanut allergies before introduction. And if the level is less than 0.35, you can safely introduce peanuts at home. And if it's greater, to do it in an office setting. And really the reason for that is to, again, not delay the introduction of peanuts to children even with high risks of peanut allergy, because we know from that LEAP study done in 2015 that late introduction of peanuts actually results in an increased risk for developing a peanut allergy. And so that's kind of my one special consideration to serum IgE testing before solid food introduction. So kind of my bottom line takeaway from this is, when you're thinking about introducing solid foods to your baby, bring it up with your pediatrician, make sure they're developmentally ready. You want to do it sometime between 4 to 6 months, but not after 7 months. You want to get those allergen introductions in early, again, before 7 months. And then you want to think about just making sure that you've covered all your bases from a nutritional standpoint. Make sure your baby's taking their vitamin D, make sure they're taking their iron if they need it. And most importantly, try not to overthink the whole process and just have fun with it, because it's a really fun and exciting time in your family's life when your baby gets to start trying new foods.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.